Hello guys, welcome back to B's 20th Notebook. Today we are going to revise the entire radiology in a matter of few minutes. So I've included all the buzzwords, keywords and high yield points that you will find it in your last year INICET or NEET or fmge papers. So kindly save this video for last week revision and you can use this as a revision module every time you revise. So let's revise it together. First in CVS, if you see a boat-shaped heart, it is tautology of Fallot. If you can see box-shaped heart, it is Epstein's anomaly. If you see a figure of 8 or snowman or cottage loaf appearance of the heart, it is TAPVC. It is nothing but total anomalous pulmonary venous connection. If you see Egon side or Egon sting appearance of heart, it is transposition of great arteries. If there is a figure of 3 appearance or if there is inferior rib notching, it is coarctation of aorta. Bat wing appearance represents left ventricular failure. Now let's go to GIT. If you see a claw sign, it is interception. Cervix sign will denote CHPS, congenital hypertrophic pyloric stenosis. You can see it in ultrasound. Single bubble sign, if you see, it's pyloric stenosis, and double bubble sign, it is duodenal atresia. If you see triple bubble sign, it's jejunal atresia. If you see multiple bubble, it is ileal atresia. If you see corkscrew appearance in esophagus, it is diffuse esophageal spasm. If you see rat tail or apple core or shouldering appearance in the esophagus, it is carcinoma of esophagus. Bird beak appearance in the lower esophageal sphincter area, it is achalasia cardia. If you see the same bird beak appearance in barium enema, it is sigmoid volvulus. Chain of lakes appearance denotes chronic pancreatitis. Non-enhancing areas of the necrotic tissue, it is acute pancreatitis. Sausage-shaped pancreas, you can see in IgG for autoimmune pancreatitis. Football sign, it is pneumoperitoneum. If you see sawtoothed colon, it is diverticulosis. If you see lead pipe colon, it is ulcerative colitis. Inverted umbrella sign denotes ileocecal TB. Valvulae conniventus is small bowel obstruction, mainly jejunum. If you see Hoste, it is large bowel obstruction. If you see a foreign body, a spherical or round-shaped foreign body, in AP view, it is foreign body in esophagus. If it is in AP view and it is slit-like, it is again foreign body in trachea. If you see a double ring sign in AP view, it is button battery in esophagus. But button battery will look like a slit in a lateral view. Feline esophagus is seen in reflex esophagitis. Comb sign is seen in Crohn's disease. String sign or mushroom sign is seen in pyloric stenosis. Accordion sign, pseudomembrane colitis. String of pearl sign is again an intestinal obstruction. Coming to RS, if you see a white-out lungs in chest X-ray, it is hyaline membrane disease. If you see sundry appearance in the hilar region, it is transient trachepnea of newborn. If you see gloved finger opacities, it denotes allergic bronchopulmonary aspergillosis. If you can see symmetric hilar lymphadenopathy, then it's sarcoidosis. Eggshell calcifications in the hilar lymph nodes, it is silicosis. Monod sign denotes aspergilloma. If you can see nematocele, it is Staphylococcus pneumoniae. Barcode or stratosphere appearance, you can see pneumothorax. The normal one is seashore sign. Air bronchogram, it's non-specific. You can see in ARDS consolidation and even more. Reticular pattern is seen in interstitial lung disease, while honeycombing is seen in usual interstitial pneumonia. Basal ground glass opacities or subpleural sparing, you can see in non-specific interstitial pneumonia. Tramp tack sign or signet ring sign or bunch of tape sign, all these can be seen in bronchiectasis. Water lily sign is nothing but crumple membrane that you can see in hydatid cyst. Hydatid cyst doesn't come under RS, but I have written it here, I'm sorry. Crazy paving pattern or ground glass opacities you can see in COVID-19. If you see air fluid level, it's lung abscess. Canal ball appearance, it's lung metastasis. Spinnaker sail sign, it's pneumomediastinum. While if you see obliteration of the CP angle, it's pleural effusion, you all know. Coming to CNS, if there is vermis agenesis, it is Dandy-Walker malformation. AV fistula in median proencephalic vein, it is vein of Gallen malformation. Racing car sign is copper callosum agenesis. Boxcar sign is seen in Huntington's disease. Conglomerate tuberculoma. Face of giant panda you can see in Wilson's. Hummingbird sign is progressive supranuclear palsy. Tigroid pattern you can see in metachromatic leukodystrophy. Yin-yang sign in the ultrasound Doppler, you can see it for pseudoaneurysm. Biconvex shaped hemorrhage is EDH, extradural hemorrhage. If it's concave or convex, it's subdural hemorrhage. Sugar icing or CSF drop metastasis you can see in medulloblastoma. Dawson's finger you can see in multiple sclerosis. Butterfly sign you can see in glioblastoma. If you can see a dural tail sign, this is meningioma. Ice cream cone appearance is vestibular schwannoma. Snowman's sign is pituitary macroadenoma. If you see delta sign, it is cerebral venous thrombosis. Molar tooth appearance in Joubert syndrome. Mount Fuji's sign in tension pneumocephalus. Black motor oil-like fluid will be given in the question, or you can see suprasellar region with calcification, that is craniopharyngioma. If you can see any mass in cellular or paracellular area, it is pituitary adenoma or maybe Rathke's cleft cyst. These are DDs of craniopharyngioma. Snowman appearance or figure of eight appearance at the cella is the same as that which I have seen earlier. It's pituitary macroadenoma. I have repeated it here. You can see multiple vesicular cyst with colics, that is neurocystic psychosis. This is a repeated PYQ. Coming to the renal system, if you see a flower sign or handshake sign, that's Harshaw's kidney. Adder or cobra head sign is ureterocele. Putty or cement kidney, or you can see thimble bladder, these are all TB kidney. Maiden waist sign is due to retroperitoneal fibrosis. Fish hook appearance you can see in retrocaval ureter. Now let's see ortho. In ortho radiology, mainly they'll ask about bone tumors. If you haven't seen my previous ortho revision video, please go kindly see that. It will be very helpful. In that video, I haven't included any of the bone tumors, but now I have included all the benign and the malignant tumors. So first, if you can see a nidus in diaphysis, it is osteosteoma. So bubble appearance in epiphysis denotes giant cell tumor or osteoclastoma. Sundray or sunburst appearance or maybe Codman's triangle in metaphysis is osteosarcoma. Codman's triangle is not specific, so don't judge the question with Codman's triangle. It can be in Ewing's also. Onion peel or lamellated appearance in diaphysis, it's Ewing's sarcoma. If you see extra bone growth away from the epiphysis, it's called as exostosis, also called as osteochondroma. If you see the phalanx of hands, or if you see any food picture and it's about bone tumor, it's of course going to be enchondroma. Fallen leaf sign in metaphyseal region, it is simple bone cyst. So all these that we discussed right now are all important PYQs. So if you don't know anything in this list, kindly go back to your main notes and please revise it all and study along with the radiology pictures so that it will be easy for you. This is just to revise the entire radiology within few minutes for your last minute revision. Thank you for watching and please do subscribe for more revision videos for NEET, PG and INICET. Thank you so much.